an evaluation. Are you ready?
Yes.
All right, I'm gonna have you start with shoulder flexion. So go ahead and reach your arm up way up high to the sky, all right?
All right.
All right, you can relax. All right, and I want you to extend your arm back behind you like that, okay? All right, you can relax. All right, I'm gonna stand behind you this time. I want you to do is start with your arm by your side and then raise it up to your ear, okay?
Okay.
Okay, go ahead. All right. All right, for this next part, I'll have you sit down. You can take a little break.
All right.
All right, take a seat. Okay, we're gonna measure your horizontal abduction and adduction, all right?
All right.
What we're gonna have you do is start with your arm out to the side like this.
Okay.
I'm gonna go behind you and you're going to extend your arm back behind you, all right?
Okay. All right. Sounds good.
All right, go ahead and extend your arm out.
Okay.
I'll sit in front of you. All right, go ahead and extend your arm back. You can relax. All right, now we're gonna do the opposite way. So have your arm go across your body like this, okay?
Okay.
Okay, go ahead. All right, thank you. All right, now we're gonna go ahead and do some external and internal rotation. So we'll start with external. So
Okay.
what you do is take your arm like this and make it into a goal post, okay?
Got it.
All
Okay.
right, so go ahead and start with it like that. Thank you.
Uh-huh.
All right, and go ahead and extend it back. All right, great job. Now I want you to start again. Starting position, and now go down like that, okay?
Okay.
Go ahead. All right. All right, so we're gonna get the same measurement in a different way.
Okay.
All right, so what we're gonna do is have your arm like this with your elbow tucked in.
Okay.
We're gonna do external rotation with it going out, okay?
Okay.
So let me grab my other goniometer.
Okay.
All right, so again, start like this,
Okay.
with your elbow tucked in,
Mhm.
nice and outward, okay?
Okay.
All right, go ahead. You can relax. All right, now we'll do the same thing, going inward, okay? Just
Okay.
across your stomach. All right, now you ready? Okay. All right, great job. All right, if I can have you stand up one more time.
All right.
I'll put your chair away. All right, we're gonna do some elbow flexion and extension. So first I'll start with having your arms straight by your side.
Okay.
Then have you stand with your arm facing this way. Thank you.
Yes.
Thank you, thank you. Okay, great. And if you could just bring your arm up and touch your shoulder. All right, great, thank you. All right, now we're gonna move on to supination and pronation. So that's just putting your palm up to the ceiling and putting it down to the ground, okay?
Okay.
We'll start like this.
Okay.
And tuck your elbow into your side.
Okay.
Great job. Okay, so I'm gonna set my goniometer up, and then when I tell you, I want you to put your palm face down, okay?
Okay.
All right. Go ahead. same thing starting like this, but this time I'm going to have you put your palm up to the sky, okay?
Okay.
Alright, go ahead. Alright, great job.
Thank you.
Alright, we're going to get some wrist measurements. So I'm going to have you put your elbow on the table like this.
Okay.
Okay. So we're going to start. I want you to bend that wrist all the way down, okay?
Okay.
Okay, awesome. Alright, now I want you to bend it back. Good job. Now, you can put your hand on the table for me.
Okay.
Okay. So what I want you to do is have your fingertips go towards your thumb, okay? And let's get your whole hand on the table real quick.
Okay.
There you go. Alright, so let me adjust real quick. Okay, I want you to bring those fingertips towards your thumb. Okay, now I want you to go back to center. Now let's go towards that pinky finger, okay?
Alright.
Go ahead. Great job. Alright, so now we're going to get your fingers, okay?
Okay.
So what I want you to do is make a fist, but instead of curling your fingers in, I want you to get your fingers to the bottom of your palm, okay? Great job.
Okay. So just hold it?
Yes, please.
Okay.
Okay, now what we're gonna have you do, so you're right here, I want you to bring your hands up to a little bit of like a hook, okay?
Alright.
And do the same thing, you just hold that again, okay?
Mm-hmm.
Great job. Alright, you can stay in that position, okay? If you want to shake it out real quick, feel free. Okay, now, same position. I'm going to go right here, alright?
Alright.
Alright, great job. So now I want you to do is put your palm face up.
Okay.
And I just want you to see if you can touch my little goniometer, okay?
Okay.
With each of your fingers.
Okay. Like individually?
Mm-hmm. Yes, please.
Okay.
Alright, go ahead. Great job. Okay. Alright, now we're gonna look at your thumb, okay?
Okay.
Alright, so what I want you to do first, put your hand like this. I want you to reach your thumb across your hand as far as you can go, okay?
Okay.
Okay. Alright. So you can keep your thumb in that position.
Mm-hmm.
Alright. Can you curl it as far as you can? Okay, sorry. Alright, great job. So now what I want you to do is put your hand on its side like this.
Okay.
And I want you to extend your thumb out as far as you can go, okay?
Okay.
Alright, whenever you're ready. Great job. And I want you to put your hand down.
Okay.
And do the same thing with your thumb. Bring it as far out as you can, okay?
Okay.
Okay. All right, go ahead. All right. All right, great job.
Now I'm going to check your temporal arteries. And they are +2. And I'm going to listen for any kind of a bruit on both sides. Okay. And I don't hear any bruits. I want you to close your eyes for me. I'm going to listen to both eyes as well. No bruits heard. I'm going to listen to your thyroid and your carotid. Hold your breath. Good. Breathe. And this side, hold your breath and breathe. Bring your chin up for me. Kaylee's neck appears to be, there's the muscles of the neck, sternocleidomastoid, trapezius muscles appear to be symmetrical. I don't see any masses or protrusions in her neck. Trachea is midline. Can you swallow for me? Good. Hyoid bone and cartilage go up and down as we would want them to do. I'm going to palpate on the back of your neck here for C7 and T1. Good. Now, if you can turn towards me, we're going to check your visual fields for confrontation.
Okay.
So I'm going to just make sure that you have good peripheral vision.
Okay.
I'm going to close my right eye, and I want you to cover your... Yes.
Okay.
Now what we're going to do is I want you to tell me how many fingers I have up, okay?
Okay.
Okay. Look straight ahead at me.
2.
Uh-huh. And down here.
1.
Okay.
2.
And
3.
perfect. Good. You can put your hand down.
Okay.
Now I'm just going to feel, that's okay. I'm going to feel around your eyes here. Right around your, any tenderness there?
Nope.
Okay. And anything under here?
No.
Okay. Lacrimal gland appears to be appropriate. I'm going to pull your eyelids down and just check your conjunctiva, which appears to be pink and moist, as it should be. So I'm going to just drop the gown if that's okay. All right. Now, as I look at Kaylee's chest, her ribs and clavicles are prominent as they should be. I'm going to palpate. Any pain anywhere?
Nope.
Any tenderness? I'm going to just go down your spine. Take in a nice deep breath. Blow it out. Now I'm going to put both hands around your chest here, and I'm just going to watch how your chest expands. And I'm going to take in a nice deep breath. Good. Blow it out. Now as Kaylee sits here breathing, she is, I don't see any signs of distress or heavy breathing. Everything appears to be even and unlabored. I don't hear anything without a stethoscope, so now I'm going to check for fremitus, and I want you to say 99.
99.
Good.
99. 99. 99. 99.
Good. Once more.
99.
Good. Now I'm going to percuss the chest. And we're listening to see if there's any fluid levels, if it sounds like there's any fluid in the lung. Good. Take a nice deep breath. Now Kaylee's lateral to AP ratio is 2:1, and that's what we would want to see. Her lung sounds are clear to auscultation, with vesicular breath sounds throughout, and tympany heard when percussed. There were no friction rubs, wheezes, or bronchi. Now I'm going to have you come back here. I'm just going to move your phone, Kaylee, okay? And now I'm just going to look at Kaylee and inspect her chest. And the sternum is nice and flat. There are no protrusions. I'm going to lift your shirt if that's okay. I don't see any there's no heaves, there's no lifts. Not feeling any pulsations. Now I'm going to listen with the diaphragm first at the second intercostal space or over the aortic area, pulmonic, Erb's point, tricuspid, and mitral. Now I'm going to do the same thing, but with the bell, listening for any kind of a murmur. Okay. I'm not hearing any murmurs. Its rate is 84 according to what we checked beforehand. It's regular. I hear S1, S2 without S3, S4, or gallops. Now we're going to look at your arteries, okay? I'm going to listen to your aortic, your renals, your iliacs, and your femorals, okay? First with the diaphragm. And then with the bell. And I can hear good vowel sounds while I'm listening. Okay, there are no bruits that I can hear, which is good. When I look at Kaylee's neck, I don't see any jugular vein distension here. I'm going to check your pulses, okay? We're going to check both radial pulses. +2. We're going to check your brachial pulses. Again, +2, that's good. Femorals. Good. I'm also going to feel around for any inguinal node enlargement. I don't palpate any. Let's check your popliteal pulses. Good. Nice and warm. No edema. Posterior tibial pulses are +2 bilaterally, as well as a dorsalis pedis. Good. One thing that I did notice was that Kaylee has a congenital nevi on her leg, which I am going to measure and make note of. It is dark brown pigmentation. It's about 2 centimeters long 2 centimeters wide. I'm going to cover your chest back up here, and we're going to go ahead and take a look at your belly, okay? Now, I just listened to her arteries in her belly, and I heard good bowel sounds. So I'm just going to take a look at her belly here. Nice and flat. Any pain in your belly?
No.
Okay. I am going to percuss your belly here.
Okay.
And we already listened, so you have good bowel sounds. I'm going to palpate. Tell me if there's any pain. This is just kind of a superficial. Okay. And then I'm going to put a little bit deeper here, okay? Now, I'm going to check for your liver border. I want you to take in a deep breath and blow it out. Good. And again, deep breath, blow it out. You okay? All right. I'm going to turn you a little bit towards me, and I'm going to push in here and try to check for your spleen. Deep breath in, blow it out. Good. Kaylee doesn't have any kind of distended veins on her belly. Skin looks good. Take in a deep breath and hold your breath and blow it out. There's no abnormal movement, whether she's holding her breath or breathing regularly. Her umbilicus feels appropriate. There are no irregular rings, bulges, or masses around there. Now, Kaylee, I'm going to have you sit up on the edge of the bed here. And lastly, I'm just going to palpate kind of right here at your costovertebral angle. Is there any tenderness there?
No.
Okay, good. That concludes our head to toe exam.
Normal finding. I'm now going to palpate her head, checking for tenderness and masses. Masses are absent. Does that hurt?
No.
No tenderness noted. Now I will palpate her sinuses. This is the maxillary. Any tenderness?
No.
No swelling noted. Any tenderness?
No.
No swelling noted. Now we'll check her temporomandibular joint and cranial nerve 5. So go ahead and open. No crepitus or clicks noted. Clench down for me. All right, cranial nerve 5 is intact. Now I'll go ahead and check the eyes. I'm checking her eyelashes, her eyelids, her eyes, which are symmetrical. Her pupils are 3 millimeters, which is within normal limits. Conjunctiva is pink and moist. The sclera is white. The iris and the conjunctiva are also within normal limits. The lacrimal duct is patent, which is within normal limits. I will now perform an eye exam using an ophthalmoscope, in which I'll be looking for the red light reflex, her optic disc, all the vessels in the eye, as well as the macula. Okay. Red light reflex is present. Optic disc within normal limits, as well as there are no narrowing of arteries or hemorrhaging going on. All right. While I'm at the eyes, I'm going to go ahead and check cranial nerve 2 and 3 by checking for pupil light reactivity and accommodation, and then I will check 3, 4, and 6. I perform the 6 cardinal filter gaze. All right, pupils are reactive to light. Or I'll also check cranial nerve 2. Look straight ahead and follow my pin. Her eyes did cross, which is a normal finding. Okay, now I want you to follow the pin with your eyes only. Do not move your head. Good job. Good job. Good job. Good job. job. Good job. All right. She was able to follow all movements of the pen. That is a finding within normal limits. Okay. Now I'm going to move to the ears. I'm going to check for any kind of tenderness, masses, or any noticeable lesions which are absent. Does your ear hurt? No. All right, now I'll perform an exam of the ear canal, checking for patency, any wax buildup, or any abnormalities. I'm using a otoscope. All right, the ear canal is patent. The tympanic membrane is pearly and white. I did see a cone of light as well as part of the malleus bone, which is all abnormal findings. Now, while I'm at the ears, I'm going to go ahead and check cranial nerve 8. I will begin by doing a Weber test. Okay, I'm going to hit this tuning fork. I'm going to place on your forehead, and you tell me if you hear it on both sides or one side more than the other. Okay.
Both sides equally.
All right, good. I'll now perform a Weber test.
Stop.
All right. Air conduction is longer than bone conduction, which is a normal finding. I'll now perform a whisper test.
1, 2, 3, 4.
All right, she was able to hear. Now that cranial nerve 8 is intact, that is a normal finding. All right, now I'm going to move to her nose. So first I'm going to inspect the nose. Looks like the septum is midline. Nose looks symmetrical. I'm now going to inspect the nares and the nasal turbinates. They are midline. Septum is pink and moist. The nasal turbinates are pink and moist. Septum is midline. I apologize. Okay, while I'm on the nose, I want to go ahead and check the cranial nerve 1. All right, you close your eyes and tell me what you smell.
Cinnamon.
Cranial nerve 1 intact. All right. That completes the nose. Now we will move to the mouth. Lips are pink and moist without cracking or lesion. Your mouth for me, please. All right, tongue pink and moist, back of mouth pink and moist, top roof of mouth is pink and moist, the throat is pink and moist. Looks like the teeth are intact. There are some fillings, but absence of cavities. All right, while I'm at the mouth, I'm going to go ahead and get to check cranial nerve 9 with the uvula. Say ah.
Ah.
All right, cranial nerve 9 is intact. Okay, gums are pink and moist as well. Okay, we're going to go ahead and check cranial nerve 7. I need you to clench your eyes. All right, raise your eyebrows. All right, smile, frown, puff your cheeks. All right, cranial nerve 7 to the neck. I'm inspecting the skin for any lesions or masses, which are not noted. That is a normal finding. I will now palpate the neck, checking for any masses or tenderness. Does that hurt?
No.
All right, good. Okay, I'm going to palpate the carotid artery. All right, 2+ in pounding, which is a normal finding. Excuse me. Trachea is midline. Okay. While I'm here, I'm going to go ahead and palpate, or auscultate, the carotid arteries. Just breathe normal. Okay, I'm going to go ahead and auscultate her temporal arteries as well. All right, 2+ and bounding, which are all normal findings. Okay, I'm going to go ahead and check your thyroid. So I'm going to get you to take a sip of water. I can get one over here. Just in there. Okay. All right. All right. No enlargement of the thyroid noted, which is a normal finding. Okay. Now, while I'm on the neck, I'm going to go ahead and check for cranial nerve 11. I'll get you to shrug your shoulders. Okay. And then try and move your head against resistance. Over your right shoulder.
So I need to turn this way?
Yes. Okay. Cranial nerve 11 is intact. Now, while I'm on the neck, I'll go ahead and check her lymph nodes. We have her preauricular, postauricular, occipital, parotid, right, tonsillar, okay, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. All right. I did not feel or palpate any lymph nodes, which is a normal finding.